Jorge Arreola is a 60-year-old male of Hispanic Latino descent. He currently weighs 170 pounds. His BMI is 25.1, which classifies him as overweight. He is allergic to lisinopril, which is a blood pressure regulation medication. His blood pressure is 168 over 96, which classifies him as hypertensive. His current medications are metformin for diabetes management and metoprolol succinate for hypertension. He's diagnosed with hypertension and diabetes type 2. He dislikes taking the hypertension medication as it makes him feel blah and tired, and he's unable to go to work. He has a history of drinking alcoholic beverages, maybe 3 to 4 nights a week. His diet consists of mostly authentic Mexican dishes, includes flour tortillas, refried beans, rice, and beef. His labs, his hemoglobin A1C is 6.8, indicating a history of diabetes, and his glucose presently is 120. He has a history of hypertension, diabetes type 2, and inconsistent medication intakes. His diagnosis would be limited adherence to nutrition-related recommendations related to the lack of value for behavior change, as evidenced by self-reporting that he skips days of taking his medication because it doesn't make him feel well. He has a blood pressure of 168 over 96, and he consumes alcoholic beverages 3 to 4 times per week. Nutrition interventions would be nutrition education, to discuss with the dietitian the DASH diet to lower his sodium intake, which would help lower his blood pressure. Nutrition education to also discuss his diet and carbohydrate intake due to the fact that the patient also has a history of diabetes. There is a infographic that I actually printed out in Spanish that is available in Spanish and English that discusses the DASH diet for the patient and foods that are appropriate lower in sodium. Goals that we have for the client are to increase his intake of the daily medications that he must take for diabetes and hypertension over the next 3 months. We also want to limit consumption of the nutrient-dense foods in his diet, such as flour tortillas, refried beans, and beef products with meals for the next 3 months. We want to increase consumption of fresh fruits and vegetables with his meals for the next 3 months. Limit consumption of alcoholic beverages to the recommendations of no more than 2 drinks per day. And we also would like to attend monthly diabetes and hypertension counseling sessions with the patient. Elements of cultural competence would be to understand reasons that a male of Latino descent might be willing to skip his medications so that he doesn't have the side effects and he's able to go to work, since they tend to be the main providers in the household. Latinos are also most likely to obtain their medical advice from family members rather than professionals. And then, of course, we would also need cultural competence to be able to learn the elements of the Mexican food diet so that we could offer suitable alternatives to the patient, so that would then again help his hypertension and diabetes regulate. As far as nutrition monitoring, we would monitor his biochemical labs upon the next visit, his hemoglobin A1C, his sodium levels, his blood pressure levels. We also want to monitor height and weight over the next 3 months. And then of course repeat any nutritional related labs as needed.